Hi, class. I read the second article, Setting the Climate for Evidence-Based Nursing Practice. This article really focused on nurse managers and nurse leaders, which those of us that are in the education program might feel like it might not have related really well to us, but I still felt like there was a lot of good points that I could take away, especially working on my unit right now. Um, I'm a level three nurse, so that is like a branch of leadership. So having that responsibility, people come to you and ask you questions. So on our unit, we have a level three tree. So I have certain staff members that are assigned to me, and it's just a way to help leadership, like our assistant nurse managers and our managers, like get information out. Or if people don't feel comfortable going to those exact leaders, then they have another resource. So even if you're not going to be a nurse manager or assistant nurse manager or higher up, it's still important to be that person for change and help, people that want to promote change, like helping them get to that point. So I thought this article had a lot of good points on how to successfully do that. So, the significance of evidence based nursing practice. We can all agree that we want to give our patients the best possible care. So, using evidence based nursing practice, that is how we accomplish that goal. So, everything that we're doing, we should always be thinking, why are we doing this? And is there evidence supporting why we're doing it? So, for example, right now in my unit, we are trying to figure out how to prevent babies from having hypothermia. We have a lot of babies that get cold all the time. So at Strong, even though our babies might be small or big or from diabetic mothers or preterm babies, sometimes they get to still stay with their moms, where in other hospitals, they might go to special care nursery. So we get a lot more colder babies than other hospitals just because we have a different population. So currently, there is a whole task force working on finding evidence that supports ways to best keep babies warm. So, for example, using skin to skin technique. That's an old method that there's so much research supporting that this helps. So, just, when we're promoting the change on the unit, a lot of people are like, well, why are we doing this? And being able to be like, well, this is the evidence that supports it, I think is really a big factor to get staff buy-in. If you have solid evidence that says you should be doing this because it has shown to prove better benefits, then staff is more likely to be like, okay. I also think of when I was first starting out my first job on med surg, we would straight cath people all the time for urine, and I always thought, wouldn't it make more sense to put a Foley in instead of constantly straight cathing them? In my mind, I thought the infection would be less with a Foley catheter in versus straight cath. For my yearly evidence project, I actually looked up articles that I thought were going to support me saying putting a Foley in was better. But what I found from the evidence was that straight cathing is better, and that is why we do that. So even though I didn't prove what I thought was correct, I did find that, okay, the way we are doing it, there is a reason why we're doing it that way, and that is the way that makes the most sense. So then, even if you don't find the answer that you thought you were going to find or the answer that you wanted, at least then you know that you're doing something the right way. So even though it wasn't the answer I wanted, I felt better knowing every time I was straight cathing somebody that this is the best practice. If they don't need a catheter, that this is the best practice. So I really liked that. So the obligation as a nurse leader or an educator in leading change. So for me in the educator path, if I were an educator on a unit, I would definitely think that I would be the leader for every time some change happened. It's typically the educator's job to educate the staff and explain why this change has happened. So that's when the evidence base comes in. That's where you can be like, I have these articles and to support this new change. And I think that being a role model for the staff is really important, that showing them that you find the articles and that you are in support of the change. So, in reference to the article, I really liked just right in the beginning, it said like leaders have an obligation to do the change, but not only to provide quality care to the patients, but to create a work life environment for nurses. So, not only are we as leaders worried about patients, but we're also worried about the other nurses that we're working with. So we're not only changing practice to better the care of our patients, but we're changing care to hopefully make the whole unit a better place. So I really liked that not everything is focused on the patients, but also bringing it back just to staff. Um, and then the other highlights that I really took away from the article were like ways to promote it. And it's like changing the culture of the unit, promoting evidence based, having whoever is the promoter, your leader, nurse manager, A&Ms, or other staff, educators. You want them to be educated in finding the articles. You want the staff to be able to go to them and ask them questions and feel confident, and the staff to feel like they know what they're talking about. Um, so it talked about how even if the leadership isn't available to do that, creating groups and having champions. So this is kind of like what my unit does with the level 3 nurses. So the nurse managers and A&Ms can't do everything. So then they have this next level of nurses that are there as resources to help other staff. So same thing, finding the nurses on the unit that are really good at finding articles to help the other nurses that want to do change, but they just don't know how to collect the evidence. So pairing them up with somebody that's able to find the evidence. Those were my main takeaways from the article. I really liked the points that it made and how leaders have that obligation to create the change on the unit and that they're kind of the starting point for it. Thank you.